Hello everyone. I'm going to start off the webinar. Apologies on the slight delay. This is our first webinar and we're still grappling with the technology of Zoom. We thought we had become experts at this stage, but it's all learning. But yeah, I would like to warmly welcome you onto this first of our coalition conversations. My name is Fiona Kyle. I'm the CEO of Mental Health Reform in Ireland. And you see on the screen there, this is very much about having a conversation. And if you want to take part online, you'll see our hashtag there, hashtag coalition conversations. It's been great. There's been a huge response to this webinar, and there's a huge number of people online I can see from all over. And some of you may not be familiar with mental health reform and who we are. Now, Mental Health Reform, we're the leading national coalition on mental health issues in Ireland. We've over 70 member organisations, and these members represent a diverse range of interests, from housing to disability to children's rights to human rights to the rights of ethnic minorities. But the one thing that all our members have in common is that they all want and are pushing for progressive reform of the Irish mental health system. And mental health reform, we provide that platform, that unified voice to bring our members together to push for reform of Ireland's mental health systems to ensure that everyone in Ireland can have the best mental health outcome that he, she, or they can have. So just you're very welcome onto this webinar today. This webinar, like many webinars, has been prompted by the global COVID pandemic. This has been a hugely challenging time for us all personally and professionally. Throughout the world, COVID-19 has put strain on people's physical and mental health. It's been a huge crisis for many of our members here in Ireland. They've seen increasing needs, increasing demands. They've had to move lots of their services online. But it's also, it's a time of learning. It's a time of reflection. What we do know, and I think many people online from Ireland will agree with me, that before COVID, Irish people were not getting the mental health services that they needed or deserved. And there's no going back to that. We don't want to go back to normal. We want to really look at what we've learned through this experience and try and see how we can use this crisis, how can we use this opportunity to bring about the change, both culturally and in services that we know is needed in Ireland in particular, and I'm probably sure elsewhere. Just at the start of each of these webinars, I thought it would be really interesting to share a little bit of an update from the mental health reform. And this week in particular has been a really significant week for mental health and mental health activists in Ireland. Yesterday, our ministers, Minister Daly and Minister Harris, they both launched Ireland's new mental health policy, sharing the vision, a mental health policy for everyone. Now, this policy, it's very long, it's hot off the presses. It's 120 pages that my team and I are going through line by line to have a very in-depth response to. But overall, we believe that this policy, it provides a sound basis for future planning in Ireland's mental health and mental health recovery plan, especially to put in place for COVID. The policy has, on first impressions, it has many things that we have welcomed. There's a much greater focus on promotion, on mental health prevention, on early intervention, on enhancing the capacity of our primary and our community services, on a whole of population approach. And it's also looking at those social detriments that we all know have such huge impact on our mental health. And I think COVID has really taught us that it's so important that we understand those social detriments and their impacts. Our old mental health policy, came into place 14 years ago, so it was very out of date. But we really feel that this new policy can be quite transformative, and if implemented, resourced, and if shown the correct leadership, can really be transformative for Irish people. So as mental health reform, I would ask you, to really join us in really ensuring that we are calling for the leadership, the correct implementation, and the funding of this new policy. For those who aren't familiar with the Irish political context at the moment, not only have we launched a new policy, but we're also agreeing a new government. So 3 parties have come together and have just recently this week also published their programme for government, in which they commit to the implementation of this policy. But we know from mistakes of the past that words and commitments alone are not enough, and we really need our government to put action to those words and to the words they've been saying over the course of the COVID pandemic of how important our mental health is, and to put in place, real political leadership in the form of a super junior minister, and also to ensure, that they're driving forward this plan and they're investing in it going forward. So please follow us on our social media and amplify that message to our incoming government. Yeah, and I suppose back to this conversation and the importance of discussing as a sector what the learning is and what we want this new government and our officials to understand what we learned from this process. And this is a series, and we will be looking at the Irish context more in depth going forward. But we really thought that it's an opportunity for us not only to learn from Irish and the Irish experience, but to understand what's going on across Europe. How are other countries coping with this pandemic? What are the lessons that in an Irish context may be interesting for us to reflect on? And I'm delighted to be joined by 2 amazing and presenters. So the first person that I'm going to introduce is Dr. Daniel Chisholm, who is working for the World Health Organization. He is the Program Manager for Mental Health. And Daniel, I'm going to invite you to come on. I know we have a few problems in terms of the presentation sharing, but I'm going to make you the host, and hopefully that will enable us and you to be able to share your presentation.
Okay, let's give it a go. Good afternoon, everybody. It's still saying I can't share my screen. Oh yes, I can now. Here we go. Brilliant. So hopefully you can all see this quite clearly, and you can hear me and see me. That's technology for you. So yes, very good afternoon. Very pleased to join you all this afternoon. And thank you very much for the invitation from Mental Health Reform in Ireland for this. And it's great, of course, to have these exchanges or conversations on topics that have been so clearly made apparent to us over the preceding months and indeed years before. So what we've just planned is that I'll kick off with some comments from sort of UN and WHO perspective, and trying to situate the issue in terms of the broader response to COVID, and look at some of the impacts and on services and on communities. And then I'll pass to Claudia to talk about Mental Health Europe's work in this area. So, and then hopefully we'll have time for some questions at the end. Okay, so what I thought I'd start with is this, which is a relatively recent briefing that was published by the UN Secretary General's office. You can't go much higher than that. I suppose there's God, but you know, in the UN, you know, Dr. Gutierrez is top of the tree, and so they've been putting out some of these policy briefs on different aspects of the COVID-19, on, for example, children, on elderly populations, on disability, and so on. There's also one here on mental health, and in my view, it's one of the best sort of accounts, if you like, of the mental health impacts that we have seen. It's a relatively brief document, but it clearly sets out, you know, the main sort of types or categories of impact. And when I talk to our member states and to other stakeholders, really, you know, I talk about this sort of not a double whammy, but in a way a triple whammy of effects when we talk about mental health and COVID-19, because we not only have the obvious and immediate fear and anxiety that we all have when faced with a disease outbreak of this nature. So, you know, that's the kind of very direct impact that we have seen, of course, on a very huge scale. But it's also important to note, you know, that some of the psychological impacts of this outbreak are due to the measures that have been taken to control it, right? So IPC, infection prevention and control measures, include quarantine, isolation, lockdown, things that very few of us have experienced in our lives. And that has been deeply unsettling for individuals, families, and communities, of course, across Europe. So this is the second effect. And then the third is more the longer term indirect impact of those measures on the economy and on society. And we all know that this is going to lead to mass unemployment, massive impoverishment. Around 70 million people are expected to become impoverished as a result of this. Social exclusion, increases perhaps in inequalities, increases in distrust between populations or communities and governments, and so on and so on. So this is the third sort of wave, if you like, the longer term impact that we are already seeing, but will only grow over time. I point you to this little some examples of some of the national surveys that have been done around the world, starting in China, of course, but in the US, China, Iran, and many other countries now, showing the extent to which affected populations have expressed, endorsed questions around stress and anxiety. I also point you to this excellent website called covidminds.org, which is contains an incredible number of resources on longitudinal studies of the mental health impact all around the world, and publications that are already out there. And so the academic community has really been extremely responsive, and there's already an impressive amount of information that you can go and have a look at over there at covidminds.org. So this is the one part of what I wanted to talk about, these impacts and consequences. But of course, the immediate question then follows: well, what do we do about those impacts? How do we mitigate or reduce those consequences? And I will talk about some of these main pillars. So in the UN Secretary General's briefing here, talks about adopting a whole of society approach, about, of course, ensuring access and availability of mental health and psychosocial support services for those in need, including many of the most affected or vulnerable groups in society, And third, picking up already what Fiona mentioned, I think you said no going back, but in the MHPSS field, they all talk about building back better. And this indeed is a huge opportunity to do that and to accelerate the good things in mental health service innovation and in this time. So this is what I wanted on the impacts, and this is not sort of mental health specific, but you will see the connections, right, between some of these waves of impacts and the links to the social determinants of mental health. So in that first initial phase, of course, we see the changes in excess mortality and morbidity, levels of stress and anxiety, people drinking more alcohol, and so on. That's the immediate effects, and that gives way then to problems both in the health sector, more mental health problems, issues around, for example, alcoholism and addiction, and also a sort of change in the delivery of hospital-based services, as I will come to in the next slide. But also some of the broad issues around unemployment and increases in the risk of impoverishment and social isolation of older people. And then there's this third sort of phase where we see the risk of breakdowns in social cohesion, increases in inequality, and long-term unemployment. So this is sort of was an analysis that was pulled together based on previous pandemics and crises, and it's already, I think, coming true in a harrowing and worrying way in the world, right, as a result of this current pandemic. But it's just this to situate, so when you look at something like this, which is not a mental health specific, this is the overall kind of view on the effects of pandemics. You will see those recurring issues to mental health, whether it's family stress, adverse child experiences, stigma, addiction, inequality, social cohesion. It's all coming out very strongly. And then the other, in terms of the actual health services, so this, of course, is a rapidly changing situation. But in basic terms, you have, as we've all seen, a huge increase in demand for certain emergency services, which consequently puts a huge pressure or crowding out of other essential services. So there's been a huge dampening in the demand for services for mental health services in the acute phase, as well as for other non-communicable diseases, children, vaccination programs, everything. But this, of course, is like pent-up demand. So it's still there, and it needs to come out, right, in the ensuing months. But also, you see the bottom line, which is going to be the increased need or demand for mental health and other services resulting from the economic fallout of the crisis. Okay, so I put a little arrow where I think many countries in Europe are currently, just to also kind of remind us that we're a long way. We're in the midst of this. This is in the midst of a marathon here, not a sprint. So then the main kind of issues, of course, that we've seen across a whole range of countries, initially, particularly in northern Italy, and then in places like Madrid and Spain, and then the UK, France, and many other countries, of course, subsequently. But there was this sort of early documentation and sharing of experience. We ran a webinar, it seems like a lifetime ago, but it was probably end of March or something like that, particularly focusing on Lombardy and Madrid, where we heard about the dramatic immediate reductions in facility-based services in places like Lombardy, and all the wards being taken over for COVID. But of course, the result of the lockdowns was also a complete diminishment in the community-based supports, community-based programs as well. And of course, we also have been reading about, of course, the huge effect that this has had on the workforce, the mental health, and the other related workforce. Both worryingly high levels of infection. People are not initially geared up with appropriate equipment or know how to use it appropriately, and so on. But then, of course, not just the infection, but there's the psychological strain as well. And then the main mitigation strategies that have been taken across different countries have been an effort to hang on to some essential level of mental health services, very pared down, but keeping it there, and advocating that mental health is one of the essential services that cannot be allowed to be completely removed. And then, of course, the major move has been switching to remote digital platforms, telemedicine, as the alternative means. And in many cases, maybe that has worked well and sufficiently, others less so. And of course, it doesn't reach everyone. Some people don't have an internet connection, including my mother, which has been a bit annoying the last few months. And then the final thing, of course, in response to there's been a big focus on the need to support, provide psychological support to healthcare and frontline workers, has been another notable mitigation strategy. Talking about some of the what are the main kind of components of a appropriate response as well as recovery. We already have, of course, had many disasters and emergencies in the world, and there is a well-developed field of mental health and psychosocial support in emergencies. And what we have now is not a specific emergency like an earthquake or a tsunami or something of that disorder, or indeed an Ebola outbreak in West Africa, but we have really a kind of, I would say, a generalized, crisis here, as affecting the whole global population. But the phases are still the same, right? You want to, and this is what we need to learn for maybe a future pandemic or a second wave, is preparedness. Then there's the actual response, which is what we're in the middle of now, and we've just described some of those issues from the previous slide. But then we also need to very much keep in mind the recovery dimension. So how do we plan for that? What does recovery look like? What does it mean? What do we want to include in that? So I'll say something about that. And we also have this well-known pyramid. I mean, we have this in WHO way of thinking of about mental health services and its organization. This is the equivalent in the mental health and psychosocial field, taken from interagency standing committee guidelines, which have been very widely used and distributed. So he's basically starting with basic needs in the community and for individuals, and then strengthening, for example, family and community supports before you then start thinking even about face-to-face, person-to-person supports and specialized services. So there's this kind of spectrum, sort of range going from general population-based information communication and psychosocial information right up to specialized care for people with enduring needs. So an example of this from your neighbor in Northern Ireland, which we heard about at a very good meeting, just a webinar a few days ago, of the EU Comms network. And I think it was Bill Murphy and a colleague who were talking about this spectrum of support in this COVID well-being in Northern Ireland. And you can see how it moves from this kind of mental health information through to a sort of self-help toolkit, things that you can do to promote your own well-being, through to helplines, services, and more. So exactly this kind of pyramid, conceptualized pyramid being put into actual practice. And so head over there and have a look at what they have got to offer. But then I thought, well, hold on, I'll go back south of the border, and here is your new mental health policy. And I picked this out this morning after Fiona kindly shared it, the link. And you see it's exactly the same, and it's an inverted pyramid, which is very trendy, very good, because it means the top is, you know, to do with the mental health and well-being, and we get the specialist services sort of down there. But it's exactly the same message, of course, that you have this continuum of need and needs for support, and you can see the kind of action. So what I would strongly say here, just, you know, I'm proving really, you know, this is brand new off the press. It's a perfect kind of mapping of the kind of actions and activities and the approach that you would take in a COVID, in mental health, you know, appropriate, effective mental health response to an outbreak like, or pandemic like COVID-19. So you, in other words, have all of the key building blocks or ingredients of a successful and appropriate response in this policy and plan. It may not talk about COVID-19 much because it was developed, no doubt, before this outbreak took place, but you can see how it fit very well to the kind of conceptualization I was showing just before. And then my final slide just talks about coming back to the, you know, to the mental health, well-being, and resilience part, which we didn't discuss so much to date. And again, this is taken from a webinar I had with some colleagues in Sweden, in Stockholm, just a few days ago, who are very interested in promoting and pushing a mental health and well-being agenda. So they had a stakeholder meeting. We were talking about some of these issues around a whole of society approach. What does that mean? What does it look like? What are the key ingredients for that? And again, I see that in your policy document, but then how to make it into a reality. And of course, I think a lot of it basically comes down to people coming together from different sectors, and this crisis provides a very good opportunity to do that. Everyone is thinking and understanding mental health and well-being at the moment, so increases the chance of effective joint planning and communication and so on. But also, you know, it's all very well planning and funding, but then what are the real new opportunities and incentives? People sometimes need to be incentivized, particularly in local communities and governments, through, for example, health promoting schools, wellness at work programs, urban design even. And there may well be some big changes coming in urban design, I think, as a result of this pandemic. So that's the local government side. And then in terms of local communities, how to engage them. So some examples, of course, would be, for example, around self-harm and suicide prevention. There are many things, community, that's where things need to really ultimately happen, and communities can really engage on a topic like self-harm and suicide, even though it's a difficult topic. Very concrete actions that can be taken, and as well for children and adolescents. Dementia-friendly initiatives is another very good example. The people with dementia are being terribly affected by this, you know, because of the isolation or not having, you know, having some cognitive impairment, which has made this unimaginably difficult, I think, for many families and individuals. So having dementia-friendly initiatives in the community is another good example of how communities can engage and support. So I think I've probably spoken long enough, and I'm keen to pass the floor over to Claudia. So I will stop there. There are some, these are all linked. There's some UN resources. There's obviously thousands of reports and briefings and reports. These are some of the main ones from the UN side. I mentioned that policy brief. There's this interagency standing committee, which has been really putting out some of the most important international documents. I don't know if you've come across My Hero Is You yet, but it's a great kids storybook. It's been translated into, I mean, dozens and dozens of languages, even Cornish, I noticed the other day, and Welsh. So, and then some of the ones from WHO and UNICEF. So I'm happy to take some questions either straight away or after Claudia has spoken. So I'll pass it back to you, Fiona, and I'll stop sharing.
Thank you so much for that, Daniel. Yeah, I think we'll take questions at the end now to save with the technology. But thank you so much. I think that was super insightful. And what struck me as well is, you know, you're referencing webinars and other learning platforms that you've been on yourself. And I think that's what prompted us. You know, we're, as organizations, as countries, we have so much to learn from each other, and I think there's a real opportunity to look at this. And it was really interesting to see the standing committee's work on that slide, and then the diagram from our new mental health policy as well. And we really hope, you know, that cross-governmental approach is one that we're really pushing for as well. Now it's going to be a technology challenge for you, Daniel, because I'm going to ask you to make Claudia the host.
Oh, right. How do I do that?
So you didn't know that you would be given this test when you agreed to do this, but I think if you click on her, you can pass the host is what we'll be doing. And I can introduce Claudia. So Claudia is from Mental Health Europe, and I think she... Oh, are you the host, Claudia?
No, not yet. How do I do that? Hold on.
If you click on participants and then go to, then you'll see Claudia should be there 5th in the list. And then if you hover over her, there should be 3 dots. And then if you click on the 3 dots, you can make her the host.
No, I don't have the 3 dots hovering over her name.
Do you have a more button, maybe, Dan?
Ah, yeah, more. Yeah. So, make host. Got it. Done.
Thank you, Dan.
That was the most challenging part.
Claudia, if you want to share your screen and maybe let everyone know a little bit more about Mental Health Europe, which is the European coalition advocating for better mental health. So it's very similar to mental health reform, but at a European level. Over to you, Claudia.
Hi, thanks. Thank you very much, and thanks for inviting us to speak here today. And I was also pleased to join forces again with Dan from WHO Europe during another very relevant, of course, webinar. And I think that like work to improve mental health services is really more important than ever here. And this crisis has particularly also confirmed how community-based services are really good for and key to good mental health support. And I wanted to stress that I think there is also, this crisis really showed that there is very much a need to shift from institutional to community-based care. This is now clearer than ever, and this is something that Mental Health Europe continues to advocate for. And I will explain you what we do at Mental Health Europe. Mental Health Europe, we are basically the largest European network organization that is independent. And when I say this, it means that we refuse any funding from pharmaceutical and similar industries. And we do this because we want to make sure that we can keep our credibility and also to avoid any conflict of interest. We're committed to the promotion of positive mental health, to the prevention of mental distress, the improvement of care, but also very much we advocate for social inclusion and the protection of the rights of users and ex-users of mental health services and persons with psychosocial disabilities, and for the rights of their families and carers. And we do also a lot of work to end mental health stigma and discrimination. We have here, it says still 30 years, but we actually turned 35 this year. We wanted to celebrate a bit. The current crisis has prevented us so far from doing so, but well, now we can say we have 35 years of expertise in the field. We have over 7 members across 30 European countries in the European region. And we represent users and ex-users of mental health services, but also service providers themselves, families and carers of persons with mental health problems, but also volunteers, healthcare professionals. It's basically everybody that wants to work on mental health from a human rights and psychosocial approach. We work closely with the European institutions and with international bodies, including the UN and WHO, for instance. And together with our members, we formulate recommendations for policies and for practices to develop more mentally friendly realities. We really place the users of mental health services at the core of our work, because we think that if you want to have real recovery in mental health, that's where you really need to put emphasis and to invest. Well, we do promote very much a psychosocial model of mental health as opposed to a biomedical model. So this means that instead of seeing persons that have mental health problems as patients that need to be cured, and mental health as something that is purely due to genetic or biological factors, we see the person that has mental health problem in its entirety. We consider the environment in which they are, their history, their relations, and also we consider these persons as experts in their own lives, and so key to their own recovery. We focus also very much on recovery-based communities mental health care services, and that is why I also mentioned at the very beginning the importance of really starting to move more and more towards this type of mental health services and leave behind institutionalization, but I will come back to that a bit later on. And in this particular period, of course, we are focusing on various things. We are focusing on vulnerable groups, so youth, but also migrants, on transparency between interactions of the pharmaceutical industry and healthcare professionals. We also focus very much on the implementation of the UN Convention for the Rights of Persons with Disabilities. We follow very closely the development of the European Disability Strategy. And I think that now more than ever, we are also, of course, trying to ensure that mental health is high on the political agenda, and also that the investments made are the right ones. I think that the current crisis has certainly put a spotlight on the importance of mental health, both socially and politically. It's a pity for sure that we needed to have a major health and future economic and social crisis probably to boost the concept of mental health as important, as being as important as the physical authorities and political institutions. Mental Health Europe was asked by the European Commissioner for Equality, Commissioner Dalli, to bring together the most pressing actions needed in the field of mental health and support people with mental ill health in Europe. This was very important because it was really a recognition that governments need to act now if they want to ensure that the current public health crisis does not become a sustained social and well-being crisis. The initial recommendations were then circulated also to European member states. And that was also quite important because that means that they were all made aware of what needs to be done when it comes to mental health. So I will go through what we proposed. After this, I will also talk about the aftermath, and I will conclude with some introduction on some European initiatives. And I'll also have all links to various resources afterwards, including the papers where these came from. So the first was, in terms of needs, was access to mental health services and support. So of course, we saw that in this crisis there was more and more need for psychosocial and peer support done online when it was not possible to have and implement initiatives face-to-face. we recommended really to stimulate this. We recommend, of course, to plan for increased demand in mental health services, thinking that the whole crisis, the kind of impact that it will have, both on persons that have mental health problems already, that had prior to the crisis, and that might have struggled accessing services, but also on persons that might develop some mental health problems. Investing in community-based health services, of course, and ensure access also to domestic violence support, because of course one of the issues that comes with isolation and confinement is that there is a risk of increase of domestic violence. Actually, there were some data brought up by forum, and again, I don't think I have the link there, but I'm happy to provide that about this, and especially with persons that have disabilities, including psychosocial disabilities. And then, of course, rethinking priorities of the European health agenda, which has actually partially happened, and I'll talk about that a bit later. Then, of course, the protection of human rights. It's very important to reverse the reduction of rights immediately. So in some countries, there were some measures that were put in place, like emergency measures, but some of them were, for instance, okay, we are going to change the procedure to commit someone to a psychiatric facility, making it easier, basically making it normally you would need like a judge, you would need a doctor or a nurse and someone from the family of the person. Then they removed one of the healthcare professionals, because healthcare professionals were very busy. But this really needs to be monitored and really reversed as soon as possible, because it's a very risky thing to happen. Promote basic social rights. So this links back to the fact that people will need to feel that they have a safety net to fall on the moment that you're starting to have problems with the economy, for instance, because if you know that you have that safety net, you will react differently than if you fear that there's going to be nothing there for you. And adopt comprehensive long-term strategies involving persons with psychosocial disabilities. So anything that we decide now, it is very important to involve the end users, to involve the people on whom policies and practices will have an impact, because also they know very much what they need. And then a third chunk was about public communication initiatives. So it is very important to acknowledge publicly that there are additional stresses, that it is also normal. We don't even want to push the fact that there will be a mental health crisis. And the reactions were very normal. The stress, the anxiety, not knowing. So it's normal. And this also helps very much with breaking down stigma. So one of the things that this crisis has brought on is that people realize that everybody has mental health, that everybody can have mental health problem. It is also, of course, important to launch prevention public health campaigns, share good practices across Europe. So there are quite a few initiatives, and Mental Health Europe as well has created a hub, and you will have the link about this afterwards. Invest in mental health literacy. So it is very important, especially now, to really teach people about mental health literacy, and also people, especially people that are in contact with the public. There were some cases, for instance, in Spain, where the police was not ready to relate to someone who had the psychosocial disability, had therefore officially a paper that said, okay, you're allowed to go out, despite even during extreme confinement like they had in Spain, but the police was reacting very badly about this. So it just highlighted, just as one example, but it highlighted it's very important. And WHO's Quality Rights Initiative is quite good, and we should really push for more implementation of this. And of course, try to provide accurate and clear information in an accessible format. And let's remember that not everybody can access digital tools. So finding ways with the community, for example, working with community champions on which we can reach everybody. As I mentioned, so these were the immediate reactions, but afterwards we started reflecting also the aftermath. So basically the long-term challenges and opportunities. And we published a position paper on this, which focused on two main aspects. So the first, the first, I use the elbow, it's a well it's well ingrained now. The first aspect is linked to the impact of the socio-economic factors on mental health. If anything, I think that this crisis really made it clear that what determines mental health is not just biological factors, but very much social and environmental factors, which greatly supports a psychosocial approach of mental health. And a switch towards this model means that we will be able to respond to people's needs and to be better prepared for similar crises in the future. The current pandemic presents massive health, but also socioeconomic consequences, stress and anxiety caused by working conditions, lack of adequate protection, loss of loved ones, risk or actual unemployment, social isolations. They're not new challenges, but this pandemic has exacerbated them. And we also know that this pandemic has hit some communities harder than others, enhancing therefore also health and social inequalities. So what is really crucial here is to have cross-sectoral collaborations. They're key. It has already been happening that healthcare services, social care services, police, other organizations in voluntary sectors have worked closely together and collectively, and there were some success stories there on this. And we should also not forget that for every risk factor that can be loneliness, stigma, discrimination, there are also protective factors such as strengthened social networks, effective communication, mental health literacy. And we should really, really focus on mental health in our policies. And we would like to push actually, and that's what we have started to do and we will keep doing, to ask to have a European mental health strategy, which will also bring forward a mental health policies approach. And of course, we need to make sure that there is not disinvestment, but we need to invest in protective environments that address people's social needs and provide basic social rights. The second aspect, it was more focusing on how the COVID-19 can reshape our approach to mental health support. I said again, the community-based supports and services have shown great flexibility in adapting to the pandemic by quickly reinventing themselves. And unlike long-term institutions, these services were able to keep supporting recovery in a human rights approach, with a human rights approach, and also maintain higher levels of both sanitary and dignity standards. It is indeed very important to keep having tailor-made and integrated services. And I think that something that we really highlighted and want to highlight is that the current pandemic and the still general over-reliance on the biomedical interventions bring a real risk here that there's going to be an over-prescription of medication as a first response, which is fueled by an ever-increasing also commercial influence and also pathologizing of mental ill health. So what the risk is here is that people that have never experienced mental health problems, they don't know what to do, they might go to the GP if the GP is overwhelmed or is not ready or informed enough, or if mental health services are saturated, then what is the easy thing? That's it. And we really need to move beyond these urgency-driven medical solutions and instead adopt a public health and human rights psychosocial approach. And integrated community services where users have a driving seat in shaping their recovery is the solution. There is a lot of work that can be done with peer support, for instance, that is very valid, and sometimes that is all what you need. This is not to say that you don't necessarily need medicines, but let's be careful that that's not going to use as a solution to everything. And then, yes, of course, we highlighted that some barriers that seemed hard to lift before the crisis, such as effective online psychosocial support, were basically lifted. Here, again, we need to be careful. So it is very important, very great that people can access support online. But of course, with digital solutions come also some risks in terms of data rights, etc. So that's also something on which we need to work carefully and to pay attention to it. And just now I will conclude because I'm also worried that both Dan and I will need to leave for another meeting afterwards. There are some funds, so it's now time to act. There are some European instruments. There have been actually some shifting in terms of the budgeting at the European Commission. So there a lot of work had been done on the next budget of the European Union, but everything had to be rediscussed because of the current crisis. And there were some positives. For instance, it seems really that the Commission listened to the voice of civil society and health communities, and they presented a EU for Health program, in which they injected around bit less than 9.5 billion euros. It was unexpected, positive, surprising amount, this will not be used only to manage the crisis, but also can really be expected to strengthen national health systems, etc. And then there will be some other tools, like more social ones, like ESF Plus, European Regional Development Funds, Horizon Europe, which is the research program. Which is, of course, important. It's too early still to know what exactly the money will be used for, but we are currently monitoring very closely this. And then in the meanwhile, we have worked with DG Santé, and Mental Health Europe has been selected to support, to coordinate a group on Santé's health policy platform. And the last two things, of course, there is, as I said, we want to push for a European mental health strategy, and we are very much looking forward to see what the follow-up is on the WHO's mental health European Action Plan. So these are just links that I would like to leave to you, some to our COVID hubs and papers, and we have actually two events coming up. One will be hosted by Mental Health Ireland, and it's about empowerment and recovery. And you're welcome to join. And the other one, we are still planning to host a high-level event on the future of mental health in Europe on the 2nd of October. So keep tuned, we'll give you more information. Thanks.
Thank you so much, Claudia, and such a super interesting presentation. And yeah, it's really, I think it's really interesting, some of the points that you raised in terms of, you know, the risks that we need to be aware of, that we need to really invest in literacy and in ensuring that we're using this major destigmatizing moment to its maximum opportunity, and that we're engaging with, you know, the professionals to ensure that they understand in terms of the kind of the other pathways beyond prescription, you know, talk therapies, community-based programs. So thank you so much for that. Unfortunately for participants, because I promised both Claudia and Dan, they both have other meetings that they need to go to at 2 o'clock. And, you know, the fault is on our part for not quite getting the technology as smooth as we could have on this first presentation. So I just want to say thank you and hand over to my colleague Amy, who has actually been leading in setting up, just to tell you a bit more about how questions will be responded to and around future webinars. So thank you to Claudia and to Dan, and we'll share your presentations, and we may ask you just to respond to the questions that people have asked so that we can send it out to you. So Amy, if you just want to let people know about future webinars and the evaluation, giving us feedback today as well. But I'm sure everyone will agree it was really enlightening, and these are the types of conversations that we need to have as a European sector. So thank you, Claudia, for that. So Amy?
Yeah, hi everyone. Thanks Fiona, and thanks so much Daniel and Claudia. They were just really great presentations and really great to see what's been happening in Europe and the parallels in Ireland as well. I did just post a link to the survey, sorry, to the survey for the webinar in the chat, and I'll send it out via email as well. And as Fiona said, this is a series of webinars over the next couple of weeks to look at different topics. So next week we'll be looking at the Irish perspective, and we'll be publishing information about that tomorrow. So keep an eye on our social media, and we'll be emailing it out as well. But thank you all for joining us, and thanks to all our speakers.
Thank you. Yeah, I'm going to end the webinar now. So Claudia and Dan, a heartfelt thanks, and yeah,
very nice to join you.
Pleasure.
Thanks a lot. Have a good week. Rest of the week.
Thank you so much, Dan.
Yeah. Bye-bye.
Bye.